And we're live, Chair.
Right, good morning and welcome to the Performance Scrutiny Committee people looking at the end of the year report for prevention and inclusion and adult services. Just a bit of housekeeping before we move on. The Scrutiny Committee is meeting, wow, they've changed the wording. The Scrutiny Committee meeting is being live streamed on a hybrid basis in accordance with the Local Government and Election Wales Act 2021, which will operate alongside the Council Standing Orders. The Council Standing Orders and Code of Conduct will apply at all times, and members should conduct themselves accordingly. A recorded version of this meeting will be available upon request and uploaded for public viewing as soon as possible after the meeting. Welsh translations for the proceedings can be provided upon request. The images and sound recordings may be used for training purposes within the council. Thank you very much indeed. Apologies for absence.
Yes, Chair. We've got apologies from Councillors Pym, Jenkins and Harvey, and also from Councillor Hughes, who's a cabinet member.
Thank you. Minutes of the last meeting on pages 3 to 4. Anybody moving?
I move, Chair.
Second, thank you. So we move straight into from pages 5 to 58, the end of year service report, and we're going with adult services to lead. And good morning, welcome, and if you want to take us through the report, please.
Members and everybody, really pleased to be here. My name is Mabani Moran, Head of Adult Services. So I'm just going to give you a brief overview of the report and then welcome obviously any questions that people have. So as I said, thank you for the opportunity to introduce the Adult Services End of Year Report for 2025-26. It sets out progress against our service plan. Overall, it's been a stronger year in terms of performance for adult services. Our picture is positive and resilient, improved grip, stronger assurance and clear progress across a number of our priority areas. It does need to be seen in the context of sustained demand.
No, it's okay. Sorry about that.
Okay.
Nearly fell out the window, but
That's
got it back.
Yeah.
Don't mind, it's all
Good. That's what I thought. Oh, good. Okay. In the context of sustained demand, increasing complexities of needs that are being presented to us, and continued financial and some workforce pressures, I think it's fair to say, across adult social care. So, in terms of some of the key strengths that I wanted to draw to your attention, so safe and effective services have been maintained despite the sustained demand and system pressures that I spoke of. The end of year financial position is positive with an overall underspend, supported by active budget management throughout the year. We achieved all of our medium-term financial plan savings, in fact overachieved on those for 25-26. There's been better flow for people through our system, so from our front door to our longer-term social care teams, we've seen some reduced waiting times in key areas. Safeguarding performance remains strong, with 95.9% of adult protection inquiries completed within 7 days. There's been some good progress on prevention, on re-ablement, around assistive technology and our community resource review. Very pleased to report the in-house residential care homes achieved positive inspection outcomes, and workforce stability is broadly positive. Improved induction and onboarding and high mandatory training compliance. You'll see as well some examples of impact included in the report. So you'll see the Stoke Park Circle supported living scheme that I know a number of members attended, which was great. A really good morning. The Mayor was also in attendance, and you got to see the impact really of people being able to live in suitable accommodation, regain some independence and receive joined up support. So it'd be remiss of me not to draw your attention to some of our challenges as well. So demand and complexity, sustained, I suppose, demand pressures on all areas of adult services, particularly safeguarding. You'll note that there's been an increase in referrals, also mental health, hospital discharge and the community, so across the board really. Financial pressures remain significant, particularly in our commission care budgets, and there's detail in the report about that. Our hospital flow, obviously people will be aware, may be aware of challenges in that regard, and we're vulnerable to wider system pressures. The care market remains under some pressures. I suppose the complexity of needs that people are presenting with, and some further work is still required to embed our preventative offer and quality assurance. So I suppose in summary, the services delivered really important improvements, maintained safe and effective support, and strengthened its focus despite the operational challenges that we still continue to see. So I think that's all I was going to say by way of an overview of the report, and obviously welcome any questions that people have.
Thank you very much. I'm going to open it up to the committee. We'll go through this systematically, and please just indicate. I'm sorry, I can't see when the hands actually go up.
Councillor Marshall's put his hand forward, Chair.
Right, because we're so far back at the moment from this this starting point. Saying earlier, I think I'm in St Mark's Church. But there we go. Okay, Councillor Marshall.
Yeah, thanks very much, everyone, and thanks, Mavandri, for that report. I know about what you said about the independent living, really, really good. Obviously, it was really pleasant that morning to be up there, and a great appreciation to the service and partners as part of that. It moves on to my question, which is on number 4 on the actual report, I believe, where it says about the risks. Now, there's 2 parts I'd like to ask about this, if possible, please. So the first one is just about the full mitigation basically of risks, but can you also identify where the pressure on adult services comes in? It's 20 for quarter 1, 2 and 3, but changed to 16 in quarter 4. Whilst that's appreciated and welcome to see a reduction in that, can you just put some context behind that of what's actually changed there? Because I know in the introduction you noted about the demand and the complexities as well within the service, so it would be just nice to have a bit of kind of, as I said, the context behind that. Thank you.
Yeah, thanks very much, Councillor Marshall. So it's a really good question. I think this pressure on adult services risk has been a corporate risk for a couple of years now. And the risk is around the amount of referrals, demand coming in, the complexity of people's presenting needs. And the reason that there's been a reduction recently is that we've had some really positive performance around some of our waiting lists. So we've had additional investment in terms of the pathways of care delays grant from Welsh Government. Every local authority in Wales has received that grant, and that's really enabled us to enhance our short-term assessing team offer. And what that has meant is that actually less people are waiting. One of the measures is the amount of people waiting over 90 days for a full social care assessment, and that has come right down over the period that we're talking about, the 25 to 26 year. So that in turn has had a huge impact on the longer term social care and social work teams in terms of the pressure that they're facing. So we felt that actually that risk had reduced because, as I say, we've had that additional investment. So that's the rationale for that score coming down. It's still there, there's still pressure, but it has undoubtedly stabilised, and our waiting lists demonstrate that. That's
great, thank you, Mavandri. And before the second question, just to piggyback off that response, In the future, so if we are able to forecast, is it likely to remain stable at that, or are we going to hopefully see a potential further mitigation and reduction? Is there an opportunity to know where we're looking?
I think that's a really good question, Councillor Marshall, because I believe that everything in adult services has an impact on this, and I know that members will be aware of this, but we are all part of one joined up system in adult social care. So obviously the front door, and there's many front doors, hospital, you know, the council's front door, there's mental health as well. All of that has an impact on our overall adult services system. So I believe that's why it's been such a persistent risk to try to reduce, because if you reduce it in one area, it sometimes will present in another, and I know people will know exactly what I'm talking about. So I would be really optimistic that we will be able to mitigate it. As I said, I believe our performance this year shows an improvement even on last year. So although with adult services, it's fair to say some changes take longer than 12 months, I actually would be hopeful and optimistic that if we continue to get some of the investment that we've had from Welsh Government, that we would see a reduction in that next year. But obviously, I can't make any promises around that. But we've got some really good mitigation plans in place across the service to develop it to mitigate that risk.
That's great, Myfanwy. And also in future, any contacts you have in any of the other areas which remain stable, I think, like the mental health and the RIF funding and things like that there, all at 12, etc. It leads to one of the other risks, which obviously is one of the kind of known terms to us all, I think, for the past couple of years, that being WICIS system and the replacement of said system. Is there any update in relation to that? Because as we know, the time frame for that of the system being supported is coming to its end. Are we any further forward now in terms of knowing when we're going to go live? Are we in a good position? And just to ensure that we're happy and satisfied that the mitigation is fully there, and hopefully not see problems, you know, as the system comes in. Thank you.
Okay, I'll take that question if I may. So you're absolutely right, Councillor Marshall. The new database for our client records for children and adults has been procured, and we are working as a region to ensure that is in place. But there's also a lot of national work going on. So the WLGA have been very supportive of the 22 local authorities, because we are all moving on to this new database. And I can assure you that Newport is very involved on a national, regional and a local level to make sure that we get onto the new database within the timescales, and those timescales are October next year, and we have the right mechanisms in place. There's a lot of work that our performance teams are doing and have been doing consistently this year in working with the new provider to make sure that we mitigate any bumps in the road and make sure that we are on the new system by October next year.
Right. Thank you. You have jumped about a bit there, but it was well worth that flipping about. That's the right word to use. But thank you, Stephen. You know, Councillor Reynolds.
Oh, thank you, Chair. I've got a couple of questions, but before I ask the questions, I mean, first of all, I just want to say thanks, Myfanwy, for the report. And you know, just look, jumping ahead a bit again, Chair, but just looking at the table later on in the report on page 11, I think, it just really highlights the demand for adult services, the amount of work that's done. When we're talking about over 2,000 people with care and support plans and 1,500 plus reports of adults at risk. I mean, it just highlights the amount of work, the workload that people are under. So can I just say congratulations and a massive thank you to everyone involved in delivering that service. In terms of my questions, my first one really is about the cooperation between yourselves and the partner organisations. Obviously, delivering this sort of service involves a lot of partnership working. I mean, have you had any particular challenges, or are there any aspects in terms of partnership working that you'd like to see possibly improved?
I think thank you for that, Councillor Reynolds, and you're right to thank the service area and the teams who work incredibly hard to deliver for people. I think you're right as well that adult services touches on all different kinds of partnerships, both internally in the council. Myself and Caroline, and obviously Nancy and Children's Services work really closely together alongside housing colleagues. You know, there's a lot of joint working. I think for adult services, our main key partner is probably the health board in a lot of instances, particularly thinking about, you know, as I've mentioned, mental health services, hospital, particularly hospital discharge. We know that there's a lot of scrutiny, a lot of interest around hospital discharge, a lot of work that's happened in that area. So I think, you know, we always look critically at what's working well, at partnerships that could be improved. We have a number of joint schemes, for example, Parkland's residential home, I know people will be aware of, but that's really operated jointly between us and the health board as a reablement care home. There's a positive example of practice in the report of an individual who's been supported. You know, there's a whole team of physios, of occupational therapists, of obviously carers who work to ensure that people's outcomes are met. So there's a really good example. We're always looking at ways of improving joint working with partners. Providers are also really key in this, and we always look for those opportunities, and we'll continue to do so. In general, operational teams work really well. We have certain challenges around things like continuing healthcare. You know, it'd be disingenuous of me to say that that's not a challenge. I think every adult services experiences that challenge in trying to ensure that people can access the right funding that they're entitled to if they meet the criteria for continuing healthcare. And that's something, as I said, with the complexity of needs that we see, quite often we are, you know, trying to assist people at times to advocate for their rights to access that. You know, so that is a tension, that is a challenge. But in general, we work really well with our partners, and we engage constructively with them.
That's great, thanks. I mean, my question was, I suppose, in a way, was thinking more about systems rather than personnel. I mean, I'm absolutely convinced that everybody involved is doing their absolute best all the time. I mean, I'm sure that's the case. Yeah, but from what you said, it doesn't sound like there's any systems that are particularly falling down at the moment or need massive improvements. You seem reasonably happy with that?
Yeah, I would say that, Councillor Reynolds. Yeah, you're right. I think, you know, the systems that we work in, there's always room for improvements, and we're seeing huge changes in terms of the digital agenda, AI, how the health board operate, how we operate. So it's a continuous kind of, I suppose, it's a continuous systems and strategic overview of how we do that and how we continue to work together. But you're right. It's more. I think it is really important, the operational teams and cultural changes, you know, that the strategic direction kind of sets for adult services. And we are really trying to work strongly with our partners to ensure that they understand where we're coming from. And as I said, engage constructively around the pressures and challenges that they're also facing.
Thanks, Mavani. That's good to hear. But you mentioned carers a little bit earlier. I mean, Chair, can I just ask one more question about? It's related to that. On page three of the reports, there's a phrase there that mentions developing more consistent and sustainable approaches to unpaid carer support and respite provision, which is obviously very welcome. And I've got a particular interest in this, having been a member of the Carers Forum for a number of years. So I just wonder, are you able to put a bit more meat on the bones there? Maybe just mention what specifically, or what plans are sort of specifically in place for that? Yeah,
thanks, Councillor Reynolds. So unpaid carers is you know, a real focus for us, and it spans across my area, and it also spans across Caroline's area. So I think it's really important that we look at what the offer is for Newport for carers. You know, when CIW came in, you probably remember we discussed that last year, and they undertook a performance evaluation inspection of adult services, and unpaid carers was one of the things that was on their agenda to look at. And they considered, I mean, they attended Chatty Cafe, I think it was. They attended some carers groups, and their observation was that actually the offer is good for Newport. Carers do, in general, receive information and advice when they need it. I think, however, what we really, myself and Caroline, are considering really is our overall strategy to unpaid carers, and thinking about actually how can we make it as clear, as easy as possible. There's been a lot of work nationally on unpaid carers. There's a strategy. There's also some really clear recommendations for local authorities around the websites and how people can access information. And we're taking those forward with the digital team. So we're progressing that. For adult services, the thing, and you asked the question around respite or replacement care. That's really important for that, and that's in our plan quite deliberately, to review our offer around that replacement or respite care, because we know that can enable people to continue to look after their loved one, you know. So we're looking at what is our offer. We've got a number of workshops across the service. This is one of them, to look at what is our offer of respite to people. How easy is it to access? Do people understand how how their person's being assessed for that? So it's looking at all of that in the round to pull together our very clear offer for unpaid carers. But that is definitely a focus of work. So that as I say, myself and Caroline are really are going to continue to work on. So it's not been completed by the end of year report. It's continuing into next year's reports as well.
Oh, that's so good to hear. Thanks, Mavanwi. I mean, I know in terms of the people around this table, I know I'm pushing it at an open door, but I know from when I first started going to the carers forum, one of the statistics that really stuck with me was that the amount of work that they do that doesn't then need medical intervention, doesn't need NHS intervention. And when you total it all up, it equates to the budget of the NHS. I mean, if every carer downed tools tomorrow, it would bankrupt the country. It's that simple. So it's so good to hear you saying all that. So thank you, Mavanwi. Thank you, Chair.
Thank you, thank you, those words, and you're absolutely spot on. If it wasn't for unpaid carers and indeed the voluntary sector, I believe that we would collapse and be unsustainable, and that's the critical part of how we exist in this society at the moment. Okay, Councillor Cleverly.
Thank you, Chair. Yes, I want to speak about the direct payments. I've got some concerns about that because I help run the food bank in Bettis, and we have a few elderly gentlemen coming in. The one chap, he's got Alzheimer's. Have you had any problems with the direct payments going across, or?
Thanks, Councillor Cleverly. We'd obviously be interested to hear about any individual issues on an individual kind of basis outside of this forum. That's absolutely fine. But we have made some significant developments in the direct payment service over the last few years, and they are a really important way of people receiving a payment so that they can arrange their own care and support. But as you can imagine, they then become the employer. So there's a lot of, I suppose, I wouldn't say unintended consequences, just consequences of becoming an employer that you then have to think about national insurance tax. So they work really well for some people, and I'm sure people know that it started in the learning disability rights movement. So they work really well for cohorts of people who absolutely value them, and they promote independence, but they're not suitable for everybody, it's fair to say. People do have to have eligible needs for care and support under the Social Services and Wellbeing Act in order to access direct payments. We do have a direct payments team. We do have that support. There's ways and means of contacting them that I'm more than happy to share after the meeting if that would be helpful.
That would be excellent.
That team is really responsive, and they do help with things like how to employ somebody. They'll share the adverts both on the website and others. So there is support out there if people are struggling with an existing direct payment. I wouldn't want people to be struggling with that on their own.
Can I ask if you work in partnership with Cody or wherever who supports some elderly people?
Yeah, so thanks, Councillor Cleverly. Cody are one of our providers that we work closely with. So formerly Pobble, before they appeared.
Yes.
Pobble.
Yes.
Cody. So we do work closely with them in many different areas. Some supported living. If people have, as I said, have a direct payment, they can then employ a PA, a personal assistant, to help to meet their needs. But they could also employ an agency as well. So some people, for a smaller cohort of people, that works quite well, that they can also employ an agency. So there'd be no reason why they couldn't approach an agency of their choice to also provide the direct payments. But yeah, we do work closely with Cody as well.
That's excellent information. Thank you very much. It's really informative. Thank you, Chair.
Thank you very much indeed. All going swimmingly well at the moment. Let's hope it continues, eh? Say aye. Councillor Watkins.
Okay, it's what I'm concerned about is the underspend. What was the biggest contribution to that underspend? It can't always be the good management in some cases. I noticed there's two items which I am concerned about. One is it was on page 11, was it?
Page 14, I think. It could be 11.
About Springvale. Yeah, and the spend there.
Sorry, is it page 6? Sorry, Councillor Watkins. Is it page 16?
Could be 16.
So it'd be 25 of the pack, and 16 of that adult services report.
Yeah, it's I got 25.
Yeah.
Yeah.
Parklands and Spring Gardens had an underspend.
Yeah.
33k.
I'm with you. So that was, if I can explain the MTFP proposal. So that was some beds in Parklands and Spring Gardens residential care homes. So prior to myself coming into post, some of the beds in those care homes have been changed to short-term beds. So to offer, as we've talked about, some respite for people, but they were designed, or some reablement if people weren't quite sure if they needed to go into a care home or not. And what the service area considered with that arrangement was that actually it wasn't working. So it wasn't working having them in the care homes, because actually if people need that level of care home support, it's almost too late to then do the reablement in the care home setting. So what we considered was that actually we should be changing those beds back to long-term beds where there's demand as well for longer term care home beds. So from that, we proposed that those beds were turned back to long-term use, and therefore people have a financial assessment from those. So that's income rather than underspend on that second line down in the MTFP proposal.
Going down to the next one, review of continuing healthcare for CHC.
Yeah.
That's a big saving.
Yeah. So that's a really positive position, because that is where we consider that people have the right to CHC funding, and we identify those people and we advocate for them to have the right level of funding from the health board, and then they get that level of funding. So they're no longer, when someone's funded by CHD, all of their care needs are funded by the health board. So what that means is they would move from local authority funding to health board funding. So that's where that came from.
Helping the individual to get the appropriate funding which they
That's right.
require.
That's right. And it is,
issues.
that's right. Yeah, that's correct.
The other thing was staffing wise, there was a lot of savings in regards to staffing. Is that because of vacancies or people leaving?
So I think it's a really mixed picture. We have a large workforce and we have more, if you, there's a bit further on in the report, it shows the head count for this year, which has increased from last year. Not by a huge amount, but it has increased. And also our turnover rate is actually extremely low compared to the Newport average. So that's also in the report, if you look at that. So we've got a 5% turnover rate. So it's not particularly a retention issue. We have vacancy provision built into the budget in any case, but many of our staff, I suppose, work fewer hours than is budgeted for. So we have adult services tends to have an older female workforce. I mean, that's the trend in our workforce. We tend to have more unpaid carers as a result who also work for us. People tend to be part-time. So what that means is if we have a budget of, say, a post that's full-time, so 37 hours a week, but people are only working 30 hours, then obviously we would have a saving against the budget. So some of it would be vacancies, but some of it, as I say, is where the post is budgeted, but we couldn't recruit to the 7 hours that are left by the person choosing to work less than full-time, which we have a number of in adult services. I suppose there's also maternity leave, staff receiving reduced pay, as I said, staff not at the top of their salary scale, so we would budget for the top of the salary scale for people. So if you get new starters, obviously they come in at the lowest rung usually. And some staff who aren't members of the pension scheme as well. So all what I'm trying to say is it's a mixed picture. In terms of adult services vacancies, we don't have a significant number of vacancies at all across the service. We have key pockets of challenges which are in the report around the AMP service, the Approved Mental Health Professional Service, which we completed the review for, but in general, we're not an outlier in terms of our vacancy numbers.
So what are we doing to fill that particular number of vacancies?
To fill the AMP vacancies. We've got a number of different mitigations for that. So we've made changes to that service, which is outlined in the report, to make it an all-age service. So it was previously an older person's assessment service and a younger person's assessment service. So in common with the vast majority of local authorities across Wales and all of Gwent, we've now got a one-age service. You can see you need people on duty every day to do the mental health act assessments. So you can see that if you have, it's doubling the resource, isn't it? So if you need people for the older population and the younger population, that means you may need 2 or 3 staff members rather than the 1 or 2 that can concentrate on the all-age service. So that was some of the rationale around changing the service. We were very lucky to enhance the payment because it's a really challenging, stressful role to undertake mental health assessments for people in the community, quite often in people's own home. Quite often people would be very reluctant to go into hospital, if not downright refuse to go into hospital because they're mentally unwell. And so, you're managing, we got a question about partnership working earlier, you're managing potentially police, you're managing the health board, you're managing the doctors with the beds, you're managing transport and conveyance to get the person to hospital. So we've really put a focus on that service. We've increased the allowance that are paid to those people doing that specialist role to attract more people to that role.
We're actually doing away with 2 members of staff to accommodate 1 member to go whole.
Do the all age, yeah. So there may be a scenario where you don't get a call all day, but you're still on. There's still people
I
on
get 3 by 6 o'clock.
Exactly. Well, yeah, exactly that.
Don't tempt me.
Exactly that. We've also created an OEM role as well. So we haven't had this role previously in Newport, but it's a role where you would only do that work. So for some workers, they really enjoy doing that work and they prefer that over more longer term, pieces of work. So we've created that and really pleased to report that we've recently recruited to that role. So that should ease some of the pressure because that will be what they're doing for the 37 hours a week. So that'll ease pressure on our rotas. So there's a number of different things that we're doing. Because that is a challenge across Wales and England, the amount of amps that the authorities have got.
On page 2, I don't see what it is. Progress against services area objectives, projects and actions. First bullet point, front door redesign work 2 is underway with basis. What is basis? Doesn't say.
Sorry, Chair, I can just talk a little bit to that. So Basis is a company that the wider council used back last year to look at the contact centre and how public interface with the council, and that was a review that was undertaken council-wide. The social services weren't included in that review at that time. So the work that's been referred to in that bullet point is that now the same company is coming in to look at the front door of social services, so say children's, adults, prevention and inclusion, and looking at the way that the public interface with the council to receive social services across the board, to see how we can improve that interface to make sure it is as streamlined, as easy, as simple as it can be. So we're reducing waiting times, we're reducing the number of hoops, if you like, that the public have to jump through to be able to get to where they need to be. And that review is currently in its final stages.
So Basis is another consultant company?
Yes.
Okay. The other thing you mentioned about respite. How many places or positions do you have available for respite? Because you said the short term and the spring gardens and what have you now been basically in house.
So I think it's fair to say, Councillor, that it's a very mixed picture in terms of respite because of the amount of different types of respite that we access. In general, people don't wait for respite because there's planned and unplanned, isn't there? So there are times when there's a crisis in the family. For instance, where you have an unpaid carer, maybe an older person looking after another older person, and there's one of them has a fall or some sort of crisis, and it's also maybe the other person's at home and got dementia, then you need to look for kind of available options. And we have a number of unpaid carers who have planned respite throughout the year. There's also, Central Lodge, one of our own care homes, is a respite facility for people with learning disabilities, and people will, families will, and the person themselves will often arrange and book that in throughout the year in discussion with the management team there. And while there's always pressure on those that provision, it's not at the time of pressure where we operate a waiting list. People can generally access that.
I understand that. It was planned.
That's right.
Carers would have planned respite because of it.
Yeah.
But obviously there comes an emergency happens and that planned care can't take place because of that emergency.
Yeah, that's right. And in general, in Newport, we are able to access through the private sector providers who our commissioning team have got a really good relationships with. We're able to access residential respite as required in general in Newport. there are times when nursing or what they call old EMI care home beds are required, and there's more of a pressure on them. But that is a national issue. In terms of residential respite, we can access that as required. And as I say, that workshop around the replacement care is looking at all of that. What demand have we got? We're always thinking about the demographics in adult services, quite understandably, and thinking, well, what is our medium to longer term demand going to look like? What support services are we likely to need more of? And that's part of our rationale for the workshop on respite and replacement care. So yeah, we are generally able to access it, so people can access it when it's required.
One final question from me, Chair, and that's the hospital discharge and assessment. How long is it taking now for, once the assessment has been made, to be able to get the individual out of hospital into their own home?
Yeah, thanks.
Rough idea.
Yeah, it's a really challenging question, and I understand it. I think my answer has got to be that it really depends on what's required. What we are seeing is people who have got multiple different areas of need coming into hospital, and they tend to be the people where we need to work with housing. We obviously need to work with health and community services. Yeah,
what sort of
that's it.
support are you getting from social
we need
housing?
that really joined up approach to it, and that's what we're looking at. Occupational therapists play a huge part in that as well. So we're always looking at what resources have we got in that hospital team, what do we need, what do we need in the community to discharge people. What I would say is that, we seek as a social care team to get people out as soon as possible, because we know that actually it's quite damaging. People consider hospital to be a safe place, don't they? But we consider actually it isn't for everybody, and actually people need to come out of hospital as soon as possible, and that's how we work in the hospital teams. We've got a team in the Royal Gwent. We've got social workers based in there in a team, so that they
Grange as well.
That's it. So then we've got a home first team based again on site, so they're actually in the hospital. We don't need to call on them from the community teams to drive up there. They can just go to the wards and see people straight away. So we try to get in there as soon as we can and recognise that actually staying in the hospital, people can decondition, and the worst place to assess people can be in hospital because of how people are presenting. But as I say, for straightforward discharges, we don't generally have a problem with, providing domiciliary care support to get people out of hospital. We're lucky in Newport, we've got, good timely domiciliary support that we again provide. We work really closely with those providers. But it depends on whether if there's very complex needs around housing, people need a change of housing, or people require a change of support levels, their needs have changed and they need to go into maybe a higher level of support, then that can obviously take longer than you like as well.
One further question, supporting what happened, Chair. I noticed, did I see somewhere about you've employed somebody to upgrade for DFG grants? If you've had a support there somewhere.
So the Disabled Facilities Grant Councillor Watkins comes under Caroline's.
Yeah, we won't keep that question.
Okay.
I can keep that. Thank you, Veronica. We like Caroline to have questions as well. And I don't want to miss it out. Absolutely not.
You've got to share it around, Chair.
We have to indeed, and on that basis, before I bring in Councillor Marshall, I want to take you back to the previous questions that you've answered this morning. So you're saying that adult social services is in a positive recruitment position with low vacancy levels. I need the contradiction to that on page 25 shows a £1.18 million underspend. Is this underspend driven by retention and retention issues, or are we satisfied now that there are no retention issues, there are no massive chronic vacancy backlogs? Just if you could just swoop that up and nail that one for me,
Yeah,
please.
thank you, Chair. There aren't retention issues in adult service. I can say that very confidently to you all today. We've got, you know, as you can see from further down in the report, I appreciate it doesn't appear slightly contradictory, but our turnover rate is lower than the Newport. So the amount of staff that we've got, you know, we've got a number of staff across the service that have been here for years and years and years. And we, in general, you know, the feedback from the service managers, from the team managers is actually, once people start working for Newport, we're really successful at growing our own social workers, and actually people stay for a number of years. So in terms of retention issues, you know, coming in as a relatively new head of service, I've been here about 18 months now. You know, I would have anticipated more retention issues, to be honest, than we've got. When I get the figures for some staffing in the care homes, there's not particular vacancies, even in that direct care, where lots of private providers really struggle to recruit. So that we don't have those retention issues, and we don't have those. We don't have persistent vacancies in any areas.
Okay. And one final question from me at the moment. You mentioned the provision for respite, and respite has always been underprovided. It's always underprovided for various reasons. With the Eliminate programme vastly on its way into us and being developed, you're still relying on the private sector to go out and to source residential respite care. Isn't this in? Are we going to once it's here, once we get this Eliminate programme here, how are you going to survive on the Eliminate agenda without going out to access private provision for respite? Are we going to undertake a massive programme of providing in-house respite care?
Chair,
So
I can just confirm that the Eliminate agenda relates specifically to children's services, and children's services is coming to scrutiny in a couple of weeks' time, so that would be a question for the head of children's to answer, and I'm very glad that you have asked that, because I know from that point that the head of children's will be able to give you a very comprehensive response to that question.
however, we still, as adults, and as we have to embrace as an authority, we have to embrace the spirit of Eliminate. And so this authority will be working towards the total new agenda. So how are we prepared going forward?
So what I would say again, is that for adults. So it does the Welsh Government policy agenda around Eliminate does not cover adults. So within the adult social care market, there is no regulations that have been passed to say that the private provider market will need to go not for profit. So it is a very different landscape to children. So right now for adult social care, there is a mixed market of the local authority delivering respite or residential accommodation, and there is a very big private market, as I'm sure you're aware, residential nursing care, EMI care, and that there's no indication that I see that there's going to be the same policy coming out from Welsh Government in relation to adult care. So, but of course we always look to get the best value you know, for money for the best quality care in adults, but it is quite a different policy jet than children's.
Thank you for explaining that. I'm sure that's helpful, not just to committee members who wanted to get that out, so those 3 people watching at home also will understand the difference. Thank you. Councillor Marshall, please.
Yeah, thanks very much, Chair. I suppose, like yourself, it was in relation to the underspending of staffing at 1.18 million. Just in the nature of that, what's the workforce like in terms of that? Do we have enough resources? Is the caseload manageable? Because obviously reading that, but yet reading the fact there was £1.9 million spent on commissioned services for the care and supported living, do we have enough support, or are we commissioning stuff out? Which leads to the other point then I think Chair was alluding to, is in relation to the staffing and agency fees. I know there was looks at caps and things like that in terms of staffing. Is that having any effect on the way that we are retaining our members of staff? Is that having an effect on the budget and the workforce? Is there a way of context just to give us a bit more guidance on that and why we're seeing the underspend as it is? Thank you.
Thanks, Councillor Marshall. I was just writing down the questions a minute, so I've got them all. Okay. So the first was around, do we have sufficient staffing levels in consideration of the underspend, wasn't it? So yeah, as I explained earlier, appreciate it does look like a big overall. It is a big overall figure. However, there's a number of different things that are playing into that figure. As I've explained, I would say in all adult service departments in every local authority that actually people would probably say, well, the complexity of the people that we're now seeing, you know, that there are people now that you need to spend a significant amount of time and you're doing strengths-based practice and strengths-based assessments. It's all, a lot of it is around the relationship that you can build up with the people that you're working with. So every team is different in how they operate. So in terms of you know, people's caseloads, people's time. Some teams have caseloads, some teams have longer term caseloads. For some teams, they just operate in an emergency environment, such as the AMP role that I was describing earlier, or hospital discharge, where it's actually very, very fast paced. I think what we would say is where we consider that we need that investment. So, for example, the short-term assessment team, we've had that pathway of care delays grant that we've used for some of that. So I think that shows that investment has made a huge impact in terms of people's waiting time. So I think it shows when you invest in key areas of staffing. Now, of course, if you are going to recruit permanently to new posts, you need to be assured that funding is going to be there. And we've talked about some grant funding previously, so you need to be assured that if people are recruited onto permanent contracts, that you're then going to have the funding as it goes forward. You know, we have generally very good work-life policies and well-being policies in Newport City Council, and a number of our staff do choose to work less hours, but for their own personal reasons, less hours than is budgeted for, and that is particularly prevalent in an older female workforce who tend to have more caring responsibilities. So, you know, it is a large figure, but for some of those caveats, I would say that it's reasonable in the kind of overall budget of 81 million. So there's that. Around the commissioned care, so that was an overspend, as is detailed in the report. The trend in adult services is to provide more intense support at home for people. Obviously, the more support that you're commissioning out for people in their own homes, the larger the cost of that package. People are only able to contribute the limit set by the Welsh Government towards that care package. So what that means then is that the local authority is then responsible for the cost of that. You know, myself and the leadership team in adult services of continuously looking at these budgets that are overspent, thinking, well, what mitigation do we need in place? What action plans do we need in place? As I said, we've got workshops across the service looking at a number of these issues. So that is being considered all the time. I think, you know, for myself, the overall picture, I appreciate exactly what, I understand what you're saying, but I think the overall picture for adult services is really important as well. So to have an underspend or to commit, you know, ideally, my ideal would be to come in on budget. That's what I would ideally want. However, you know, an underspend is also a positive for adult services. Have I answered all the questions, Councillor Marshall?
That's great, thank you. I think there was another bit about the cap of agency fees, I suppose, but I think in relation to that's a minimal on that side of things there. I suppose my main concern is just to avoid burnout with staff, because it's an area, obviously, we don't want burnout where they're already potentially carers for others in their own right, and we don't want them burn out in the workforce either. So it's just making sure that's fully adhered to, which I assume it is, but it's good to have that reassurance, obviously, for the committee today in relation to that. I suppose my last question, if possible as well, is just about the reablement performance inside of things, where it says about there's been near a 50% reduction in basically the packages this year, and just kind of looking at whether or not that is because of the rising complexities, or is it due to the number of individuals involved, or is there just a little bit more context in relation to that, please? Thank you.
Yeah, thanks very much, Councillor Marshall. You're absolutely right. Just on the staff wellbeing, apologies, I missed that point, because I was going to say as well that there's been a really positive increase in the supervision, the amount of check-ins and one-to-ones completed, and that's a really important mechanism to support staff in social services. So that's something that's worked well. So we've been working on our reablement offer probably for at least 9 months now, and we're really focused on making a positive shift for this service. So it is absolutely crucial that we get reablement working with the right people for the right amount of time, and that people have the best outcomes from the reablement service. So again, it's an example. We're based in St Woolis, and it's an example of us working jointly with the health board, with physios, OTs, nurses, and doctors that are in that wider CRT. But in terms of our reablement, we've been really looking at how can we rebrand reablement, how can we enhance the team's identity, how can we, I suppose, support more people to regain confidence, rebuild daily living skills, and remain as independent as possible at home. But in order to do that, we've had to ask the service to operate slightly differently. So we've used the evidence that we've had from this 25-26 year, but from previous years as well. But we are completely transforming the service to be a true reablement offer, being very clear, both internally and externally, about what reablement is, what it isn't, and how we're going to progress it. So it has been a genuine partnership approach. So although the numbers have reduced last year, we're optimistic that going forward, what we want is for reablement to be working with more people, to have an impact on our commission care budget. So to actually, not just budget, but on the amount of people who are having commission care, because we believe that there's opportunities in that cohort of people to actually have reablement instead. So, you know, actually when social workers are going out to review people, for them to consider, well, actually, Mrs. Jones doesn't potentially need a care agency delivering this to her, but actually we could have reablement working with her to be able to make a cup of tea herself, make a sandwich herself. But to do that, for this type of change, it's a large service, it's a large cohort of staff and managers. You really need to take staff on a journey of change with you and embed that strengths-based approach, thinking immediately, what can people do for themselves? What do they need support to do with, not just doing for? So that's the journey that we've been on, and it's been quite deliberate that they've been working with less people. However, those people haven't been left without support. We've put other support in place for people, just to reassure you about that. But we are on a complete transformation journey in terms of reablement, and you know, I'd be really pleased to give people an update at the next forum about that. So yeah, that's all I can say about that.
Thanks, Mavandri. I suppose on that one, it was just to make sure that obviously it is picked up, and in the future, hopefully it'd be better. And if there was plans on the service, which sounds to be the case there, and just any feedback on that, which I assume is being picked up anyway, as you said, for a future meeting. So look forward to that. Thank you very much.
Thank you very much indeed for that. I'm glad to hear that the workforce are deciding the hours that they work, the commitment that they can give, and that we're encouraging that and working with them on that. Going back to the other side, how does that implement on the delivery of the service? We're working like less hours with less people. What's the outcome? Less service.
Thank you, Jack. So is that in terms of reablement or in terms of the wider
Anything, the wider scope, because obviously all staff could be involved in working less hours as a choice, and so that would have an impact.
So what's your, if I can jump in there, I just think, you know, it's you're absolutely right. You have a cohort, and it's not all staff, it is some. So some may have a full-time contract of 37 hours, but choose to reduce to 30. But there will be other part-time staff who will then be able to pick up those additional hours. So what would not happen is that we wouldn't leave, for example, a residential care home with a lower complement of staff that would be needed to run that care home and meet the needs of those people who are living there, and similarly within the teams as well. So even though that individual may have reduced their hours to 30, there could be another individual in the team who would be in a position to be able to pick up those additional hours.
So before that happens, so before someone reduces their hours, I mean, they could go down to 22 and a half hours, 21 hours. I mean, so they could go right down. Do we ensure that there's a service backup? So you can reduce your hours until someone picks up your hours, or we go out and we recruit for those hours.
Exactly that, and that would be a discussion between the individual member staff and the manager to make sure that the choices of the staff, which is important, obviously, that it did not have a detrimental impact to the service being delivered. And we would fill that. Either we would agree, yes, that can be done. There might be circumstances where we say, well, I'm afraid we can't honour that request. But those discussions absolutely would happen, and it would not result in the service delivery being impacted.
Thank you. Okay, instead of going through all the pages, are there any other questions on the service reports for adults? We can't see anybody indicating. I think we've chopped through the report backwards and forwards. We're trying a different approach. Gosh, you know, trying to change. There we go. There is no other questions then. So thank you very much indeed. You're quite welcome to stay. So we're going to move on now, unless anybody wishes to have a comfort break. We're going to move on now to the end of viewer prevention and inclusion report.
So Caroline, do you want to introduce the report?
Okay, thank you. So today I'm just here to present the end of year report for 25-26 for prevention and inclusion. This is our, I believe, 4th annual report. So that we're here now and we're very well established as a service area, which is fantastic news. What I hope is conveyed through the report, I won't go through the report because obviously people have had it and hopefully will have had time to read it, but just in terms of some of the main headlines that I want to pull through is some of the themes that we're focusing on in prevention and inclusion. So very much around looking at every possibility in every service and every team that we have, looking at how do we help people as early as possible, how do we push upstream, and how do we provide that earlier help to people to keep them safe in their community, keep them safe at home, keep them independent at home. So it's all about how do we help people as early as possible. So, you know, when we are getting information to say, well, I didn't know about this until it's too late, they're the sorts of opportunities for us to really think about what do we need to do differently in order that people are aware of the help that's out there. So it's very much about pushing upstream and getting that early help out there. A big theme is also around our joined up working and our partnership working, not just internally with our colleagues in the council, but also our external partners across the sector, voluntary sector, health boards, and so on and so forth. And without that partnership working, and I've said it previously, we could not do half of what we do in prevention and inclusion. So hopefully some of that evidence or some of that information will come through in the report. You know, we've had some really good strides here. We've been able to do some really comprehensive work around our offer to parents and carers of children and young people, previously kind of scattered all over the place and all doing different things. We've now pulled all of that into one area, so we have one centralised parenting team, which offers a raft of support to parents, lots of group work, but also one-to-one if it's needed. Again, very much focused on how do we help parents and carers to be the best that they can in those roles and support their families from breaking down, needing external and more costly sources of help. How do we help that family to keep together? We've also been really successful in the expansion of Plan Start. So many people will recognise that Plan Start previously had been a postcode lottery provision, and those postcodes, the geographical areas were determined by Welsh Government, but they have been working year on year to work towards universal provision. Newport were actually ahead of the curve, thanks to all the work of the team and engaging with providers and getting them on board. We were actually one of only 3 authorities in Wales that were ready to roll out to full universal provision from April this year. And that's down to the work the team has done in the last financial year. So that's been a really, really big achievement for Newport. Young carers we've touched on with Mabanwy, carers touched on with Mabanwy, but the work around unpaid carers and young carers as well is a particularly big area for us. We know that there's a new Welsh Government consultation, they're developing a new strategy for unpaid carers and young carers, so that is very much on our radar and how we align our local priorities in line with that new strategy when that will come out. I think probably a big key thing for us is around our visibility in communities and in neighbourhoods. So we've already had 2 assets, 2 community centres that have come over to us, and we are going to be expanding that now into this financial year with another 2 areas. But, you know, the 2 areas that we do have is very much about building on what we're hearing from people, what they say are the issues that matter to them in their local community, and making sure that we're responding with the right support that people are asking for. So, and that's all about visibility and accessibility. People see the community centre door open, they know there's staff in there, and they can just walk through without an appointment and speak to somebody and get the help and support that they are asking for. And then just a quick link onto, again, as part of how we help people to keep safe and independent, there's also that link to working with families in areas of harm deprivation. Particularly, we have the No One Left Behind project that has just gone launched for the first cohort in Dufferin in the last financial year. So that's been a really, really positive project that we've been able to run that just more engagement with those communities, really hearing the voices of people in those communities about what matters to them and what sorts of projects that they would like to see in their communities that would make a difference to the quality of their lives. I hope that from the report you will see that there's a range of case studies in the report that will hopefully demonstrate to you the vast diversity of prevention and inclusion. You know, there's an awful lot involved in the portfolio, ranging from antenatal right up to keeping older people safe in their own homes, and trying to present a range of case studies to demonstrate that range for you. And I think really, as I've said, I've just touched on already, one of the key things for us is prevention inclusion is very much around that engagement with communities, engagement with individuals. We work with the residents, we need to hear what matters to them, what are the things that they feel will make a difference, so that they are helping us to shape the services that we can provide in those local communities in response. So you're telling us this is what you want, and therefore this is now what we're trying to do. So there's just some of the main themes that I wanted to pull out. I'm very happy to take any questions.
Thank you very much indeed for that. Are there any questions on that report? Councillor Marshall.
Yeah, thanks very much. Really positive year on that side there. And I suppose just with self-interest, I suppose, or personal interest about the Young Carers Covenant and how that's going in terms of that. If we could have, again, a bit more context of how that is, how are we doing, and is there any things that we could be better at and that we have picked up, identified as we're building up, as we appreciate a great interest of the work of this area. Thank you.
Absolutely, thanks Councillor Marshall. Yeah, indeed, you are a real support and contributing factor to getting that covenant over the line and signed off, so enormous thanks to you again for that support. What I can say is, obviously you will know that that covenant was designed by young carers themselves. They were the actions that young carers were telling us, these are the things that we want to work on. So we have an action plan now on that covenant. There is a working group that meets on a monthly basis to address the actions in that covenant. And what I'm really pleased to say is I think probably more so in the last year, we've become much, much closer at working with our colleagues in education. And I think one of the biggest things for us is around the identification of young carers. You know, it's something that has a lot of factors kind of contributing to it really, because it isn't just a case of somebody wants some help and yes, I'm a young carer and away we go. There are lots of caveats within that, you know, lots of young people don't recognise themselves as a young carer themselves. They may come forward and acknowledge they're a young carer, but they don't want any help. But we give them information so that they know where to go to if they need help. And then of course we have the ones that are engaging with us. But what I will absolutely say is we have to get better at identifying who our young carers are. We've got a limited number. I think Bernardo is our service that runs this young carers service. We're working actively with something like a couple of hundred young people. However, across Newport, we know and we believe that there's a lot more young carers out there. So how do we reach them? Part of working with education is about working towards having a young carers champion in every school. So that because they are ideal places where we can start to recognise and identify who these young people are. And if they don't want to access those, that's fine, but at least we know who they are, so that there's a wider context in terms of, you know, if their performance at school is not as it could be, recognising that they are a young carer goes a long way to understanding what might be going on for that young child, as you will know yourself. So I would say it's going great. It's, you know, there's always more that we can do. We've expanded our expectations with Bernardo, I would say, on the back of the covenant, which is very much around how do we get out there and engage more proactively. And as a result of that, that joint work, and particularly with education, is really, really strong now. And I think that will continue, because we do know that young carers, there's a West Government strategy for schools, and how they need to be identifying and supporting them as well. So coming together, it makes for, you know, we can make a difference here, and we will continue to do that. That's absolutely one of our priorities.
Thank you, Caroline. That's really positive to hear, and also the link of education. And I know Councillor Davies wants to come in as well. Is it possible to maybe have notes of said meetings? Are we able to have knowledge or just updates every now and again, just to kind of understand what's happening and where the areas are? Because as you know, a lot of us as governors, a lot of us are able to hold people to account in various positions. So it's just to keep on the ball and never let it go, especially for these young people and what they're doing. Especially, and I appreciate that. Thank you.
Davis?
Yeah, I think, to be perfectly honest with you, I share your passion, Councillor Marshall, with regards to young carers. You know, I look effectively on my own upbringing, and I was probably a carer for my younger siblings. I'm one of 5 children, and very much had to take on that role with younger children. But I think Councillor Trudy, the leader, actually including young people and provision of preventive services in my portfolio with education, made that link. It absolutely made that link in a number of areas, but very specific in regards to young carers. And it's something that I do push really, really hard in education, and I'm very vociferous on. So, for example, the recent Carers Week, we actually made sure that our schools focus on that Young Carers Day. And they invited people in, such like Leonardo's, and did some work on work specifically with their young carers. But it's the big challenge, as Caroline rightly points out, is that identification of those young carers. Young carers do not necessarily realise, you know, I know one particular example of a Year 5 child was going home every evening and cooking food for her younger siblings. That was an expected task. And she looked after her younger siblings until her parents came home. And all right, you can talk about safeguarding issues, etc., but however, she's actually, you know, that child was a carer. You've got to think about what being a young carer encompasses. I think a lot of people assume it's a medical need or a mental health care need, but sometimes it's that enabling to allow your parents to access to work. They've got those crossover points so parents can actually go out and get an income. And I think it's that broader picture that schools don't always understand. So there is a lot of education to happen in the schools, actually. How do you identify who is a carer and what is a carer? But I can see year on year that's improving. And I think you're absolutely right, Stephen. Taking in of that covenant made a massive difference. It was an enormous start of an ongoing project, really, because it's making a difference in young people's lives, so they get the same access to education and same outcomes. It really matters.
So before we bring in Councillor Reynolds, it's refreshing to hear that we wish to start a carers champion in schools.
Yes.
Who would that carers champion be? What's stopping us from implementing it? And as we have the cabinet member for education here, when are you going to implement it? So we're not talking about it.
What's already implemented on a voluntary basis, because it's not statutory. Look at governing bodies and statutory, you've got safeguarding, etc. A lot of schools already pick up the young carers governance role, and that should therefore come to every governing body meeting. So you actually do have, you hold your head teacher to account in regard to what work they're undertaking. But it generally, in the schools where the experience is taking place, where I push to specific schools, it tends to be that member of staff who leads on it, not necessarily a qualified member of staff, it may be that HTLA who actually leads on and has got that ELSA base. So they're actually that person that child identifies, they know they can go to, but additionality of support, that's a confidential chat, and they can actually help therefore them to drive with the strategies that need to be implemented.
I think a carers champion is slightly different to that role, but the carers champion would advocate for them,
and that's
put stuff in,
and that's what that member of staff does.
And
that's what that member of staff does. So, for example, quite recently, with a conference with schools, and I watched that presentation of how that looks like. So that was shared as best practice across schools, so they can pick it up and model and copy. You're absolutely right. It needs to be spread across all schools. It's some schools at the moment. It needs to be all schools. And I do acknowledge a variability, and that needs to change.
Absolutely, and I think that we're all singing from the same hymn sheet here. Maybe as a committee we could help you with that.
Yes.
as well as individually, and note for the recommendation for that.
Just to be really, really clear, Chair, is it a recommendation about implementing carer champions, young carers champions in schools?
Rolling out the programme across.
Maybe you need to take that to
Yeah.
Education Committee. and
Yeah, we do
Education.
need to take it there.
And maybe
but
it's a question you need to raise for the Education.
We will,
Yeah.
we will, but as a recommendation, we can work out the, we can work it out and make it work. And it might make it work day to day. So, Councillor Reynolds, thank you for showing such great patience.
Always a pleasure, Chair. Always a pleasure. Before I ask my question, I'm actually going to start with a similar statement to what I said with the adult services, in just paying tribute to the team and the work that they do. Yeah, when you look through the report, you know, it is incredible. I think it's well documented, you know, how important prevention and inclusion services are, not just in terms of finances, because obviously the effective prevention does save a lot of money in the long term. I think we all know that, but it's just the strain that's taken off other partners organizations as well by doing this. And when you see figures like 34,000 people being helped in Newport, I mean, that's just, it's mind-boggling to me, to be honest, how a team that's relatively small can cope with that sort of workload. So I really do just want to pay tribute to those people. I've got a number of questions. My first one, to be honest, is showing my own ignorance here, and I'm hoping somebody can just educate me a little bit. We were talking about partnership working, and one of the partners I'm not overly familiar with, to be honest. That's Ymddiheuriadau. I did a little search myself, and to me, they seem to be a similar organisation to GDAS, and I just wondered whether you can maybe tell me, am I right in making that conclusion, or coming to that conclusion? And can you maybe just tell me a little bit more about them?
Yes, thank you for your compliment to the team, by the way, Councillor Reynolds. I'll make sure that they get passed back. Forgive me, I will probably have to go and look that one up myself as well, but my feeling was, I think that was to do with the youth service. Yeah, that's my view, and I think it's an organisation that supports the youth service in some of their work provision,
Yeah.
I think. Forgive me, but I might have to come back to you on a bit more information. I'm very happy to do that for you outside of this forum.
Okay, thanks. Yeah, I'd appreciate that. Thanks.
Sorry, actually, Councillor, I can see my service manager pop their hand up. I suspect she may be able to come in on that one. Can I bring her in?
Right, okay.
Yeah, they provide tailored support for young carers, and so they do training within schools to help schools support young carers. So they're a sort of an organisation that then they work in Newport. They work very closely with Bernardo's, who provide the young carers service. So yeah, they go into schools and they do training for schools around how they support young carers.
Yeah.
Oh, okay. So when I looked at it myself, I saw statements about substance misuse and that sort of thing, which is why I made that connection to GDAS.
Oh no! Well, as far as I know, in Newport, that's definitely what they do. They provide training for young carers in schools.
Oh, thanks for clarifying that. I appreciate it.
Okay.
Chair, can I just check? My next question really is to do with page 8 of the report. Are you going through this sort of page by page, or can I jump ahead a little bit?
Yes, jump ahead. I think this morning we're trying something different.
Okay, thank you, Chair. The question is about the statement on the development of a Housing and Social Services Board, which to me seems to be a really vital initiative in this. But at the moment it seems to be paused. I was just wondering whether maybe you could clarify why is that paused at the moment?
Yeah, absolutely no problem. What I can say is initially there was a willingness from Atal to move towards setting up a formal board between social services and housing and communities. In order to do that, you have to establish quite a robust infrastructure to make sure the housing works. So, you know, in terms of processes, in terms of reference and commitment, really. So we need resources in order to get to that point. What I will say is, and we've had a number of workshops with all the service managers across both areas for the past year. And what we've come to the conclusion is actually there is an awful lot of excellent joined-up working going on already. And actually, did we need to create a formal board? So what we've now done, and this is actually only in the last meeting that we've had, probably in the last sort of few weeks, is that we will not go forward with creating a formal board as such, but what we will have is quarterly meetings that are committed to and attended by all heads of services, cross-social services and housing and communities. And we have agreed a process. In fact, we have agreed in terms of reference to that as well, but we've got some very clear work streams and we've got some very clear leads on these work streams, and using it as an opportunity to bring together all the information around what is going on in the name of social services and housing, because there's lots of work that goes on in that space outside of our direct teams as well. So part of this this new process that we've had, we've agreed, is that we're going to put in place some clear leads for these pieces of work. They will be bringing back all the updates, information and progress made against the work streams, and they will report back into the quarterly meetings that we have set up. So it's not that they disappeared, it's certainly not gone off the table, but what we have said is, do you know what, we're actually already doing some fantastic work working together. We've got a clear process, we've got a priority areas, we clearly, so actually we felt we were content with that way of feeding into the information and making sure that the joined up thinking, the joined up strategic approach is there in those meetings. So that, you know, and a good example is if there are gaps. So, for example, a good thing would be around substance use and people who are homeless, and maybe people who are struggling to maintain their tenancies because of their substance use. You know, they're the kind of discussions that we will bring to those group meetings now and identify, you know what, have we got a gap here? Is there something we need to think about in terms of doing joint up commissioning? So please don't be put off by the fact that it says the board has been paused. The work is continuing, and there was a very clear process and commitment for it to be to continue, and it is.
That's reassuring. That's lovely. Thanks very much. I do have one more question, Chair, to do with funding, but I think there's funding questions coming up later on, so I'll probably hold on for that one for now. So thank you, Chair.
Thank you. Councillor Cleverly.
Thank you, Chair. Morning all. Thank you, Caroline. I'd just like an update on the Bettis project. Have we got a date for the end of the consultation period and a date for the start of the project? If you don't mind, thank you.
Well, I don't know. I have to say this, that the scrutiny meeting isn't for updates from officers.
Oh, sorry.
But seeing as you've asked it, and it's a sunny day, this is the one and only time I'm going to allow it. So if you just want to be quick.
That's okay. Can I just double check you're referring to the No One Left Behind project in Batters?
Yes, that's correct.
That's okay, because we've got a couple of big areas of work going into Batters now. So the consultation is out now. I believe it will be for a period of, I've got mid-August in my head. But I will double check that for you, Councillor Cleverly, and come back to you on that. But we are at the stage of engaging with residents of Batters and organisations and groups that work in Batters. The information we are gathering, that will then very much form the criteria for what we go out to commission for going forward. But I will absolutely come back to you with a much clearer time frame on the closing date of the consultation, if that's okay.
Thank you very much.
That's excellent, thank you. And can I just say, I'm really delighted about the new detached youth worker team, because that's absolutely excellent, and I've been asking it for this for a long time. It's quite close to my heart because that was my first full-time post as an outreach and detached worker. So I wish you all well in that. Thank you very much. Thank you, Chair.
I welcome
Okay,
the report, Janet.
thank you very much indeed. I know that Councillor Reynolds wishes to come through, and we have flipped through on the papers today. Are there any other questions? Councillor Reynolds, I know you want to come in.
I think Councillor Watkins indicated Chair.
Oh, sorry.
Oh,
No, I've got Councillor Reynolds first.
Shall I?
Yeah,
Shall I?
I've got a
He's been awfully patient. You know.
Aye.
Councillor Reynolds.
Oh, you have. You're good to me today, Chair. Yeah, I mean, my question, I got a feeling this was going to come on the back of Councillor Watkins' questions anyway, so this might go slightly backwards, but never mind. It's particularly to do with the funding regarding the Fordasv framework for children and young people's participation in the planning and delivery of services. That's a bit of a mouthful, isn't it? It's on page 11 of the report, is that statement that's mentioned there. And it says that funding is being secured to commission this expertise. And I'm just wondering, what's the expectation of that funding being secured? Is that, to coin a phrase, a done deal, or is there any doubts about that funding being secured? And if there is doubt, then is there a contingency plan to cover that loss? I hope that makes sense.
I'm sorry, thank you for the question. I'm just thinking that through. I haven't heard that funding has been secured yet. But again, I can chase that up and check where we are on that and feed that back to you outside of today's meeting. The funding for that particular, it is quite a specialist area of work, and there isn't a huge budget attached to it. So I do need to go back and double check that for you, and I will confirm that for you.
Okay, thanks. I thought I'd sort of preempt Councillor Watkins, but I think there's probably going to be a few questions from his end about funding. So my question was sort of on the back of that, really. But no, thank you, I appreciate it. Thank you, Chair.
Yeah, on page 14.
Yeah.
Or page 49, whichever it is, performance measures.
Yeah.
I know on the first item there, new percentage of 10 to 17-year-olds engaged in the AW. Over the past years, we've brought out of Newport children back into Newport in specific accommodation. Are we doing the same for women of violence and families who have experienced violence? Are we putting them in a specific accommodation? And if I don't know where, but
yeah,
because it's getting more and more.
Yeah, so the reason I haven't got the actual stats on that is because we are not responsible for that provision. So what happens is we have commissioned specialist sector organisations, so like Women's Day, for example, Serrano, they are specialist organisations that are the frontline delivery for these individuals. So anybody who is coming to our attention or at risk or experiencing domestic abuse, sexual violence, we will be referring them into these organisations. So yes, women who are deemed at high risk will be put in their places of safety, so like a refuge. Absolutely, they would not be left living in a position of risk. What I would say is I imagine those places are fairly limited. Purely because of budgets and funding availability. But yes, in answer to your question, yes, that is happening. But because we don't directly run that provision, I would have to get that information for you.
But you would support the individual or family with that?
Absolutely, yeah.
Thank you so much. Carers coming back. Flying Start, you mentioned about Flying Start that it was being centralised within NCC now. Who made the decision from Welsh Government not to do it, and then come back to NCC. Did it, was it Welsh Government said you can go it alone?
So, Sarah, can I just check what the question is? So who made the decision?
George,
Sorry.
so I think maybe what you, just to clarify, you're talking about the rollout of Flying Start across the whole of Newport. So it was
it wasn't joined up.
That's correct. Yes. So it was historically was only in certain areas of Newport, and that was a Welsh Government decision. And it's also a Welsh Government decision now for it to go across the whole of the local authority. And in response to that, they've given the Flying Start programme additional grant monies to enable that to happen. So it is no longer a postcode lottery in relation to childcare. It is available to everybody who lives across Newport.
And if I could just, so it would be a collaboration between our team and our account managers who will work with the Welsh Government to say we're working towards this, we can achieve this by April 26th. Welsh Government systems check in and they agree for us to roll it out.
Just before you can you send us, members of the committee, a copy of all the areas that this is now being rolled out to or available to?
It's the whole of every family who has a,
What you've also got is your private providers, so you've got the funding goes to them to support it as well. So yeah, it's a whole of Newport, it's mapped across.
There are no areas now.
So is Newport NCC responsible for that?
Yeah.
Or is it still Welsh?
So Welsh Government give Newport City Council the grant money to deliver the free childcare offer across Newport. And as it has already said, and that can be through private childcare providers, which in the majority is, but we do have a small number of childcare settings that the council runs as well. So it's a combination, but mostly it's private.
Okay.
Two other questions. One is you mentioned about training for teaching staff to look for carers, young carers. Would it be advisable to have a training session for governors who are responsible for, let's say, safeguarding or something like that?
I agree. We can take that back to the education team again, okay? Because obviously government sits with the education team, but I completely agree with you. It would be very beneficial.
The last one, Chair, is budget. We were informed that we don't have a budget. Actually, or very minuscule, should we say. Can we have can the Cabinet as a whole look at supplying a reasonable budget, and then that will help in regards to you rolling out the support for individuals as well as the grants coming in, because a number of other organisations have grants coming in, like highways, for instance. They have a budget, they also have grants coming in to do specific things. And I wonder, can we look at that?
So, Chair, sorry, just to add to that, there is a small core budget. It is small in compared to the size of the grants. And I think what the leader of the council has tried to do in support of what you've just said is to instigate the No One Left Behind fund. So, and I'm sure President will add to that. But so every year there is 500,000, which is, I just have to check my thinking. Yeah, 500,000 being invested. So you've already heard we've had an update. It's been invested in Betis. It was previously different, and there's a methodology as to which area it goes rolls out to next. So I think that the leader has done that in an effort to address what you just said, in part.
And the additional.
Can you identify the budget, please? the event?
500,000.
Yes, it is.
No, for the,
For prevention and
Yeah.
treatment.
Oh,
That's 600,000. And then 500 for no one left behind.
that's a separate thing,
Yeah,
that's
so
not your
That's
budget.
600,000.
Yeah.
So
So it's a
it's
600,000
600,000
core budget
core budget.
from the council into prevention and inclusion, and the 500,000 reoccurring for the no one left behind.
Yeah, but that could stop in the like whole.
Well, it's currently recurring.
Yeah, I get that, but let's not mix up.
No.
One thing and
And-
another.
All grants can
And-
stop at any time.
Absolutely, and this is where Councillor Watkins is
Yeah.
coming from.
Can I,
So,
but,
Just a second, no, we don't want you involved just yet.
I can explain where some additional money comes from as well.
Can you, what, from the Welsh Government?
No, Councillor Trini's leader, for example, last year, he looked at very specific support and funding issues with both, we looked at youth provision, for example, and he was able last year to provision additional funding for up to 200,000 into youth provision, and that's being used in very specific areas in our city. We know there's particular issues in regard to antisocial behaviour, to being able to fund those projects and specific focus. So Dimitri, when there's money available, he gets his grant funded. It's tight, it has to be tightly managed, and where we can, we put additional money into we get those underspends, we see money coming our way, which is all very welcome, and I always make sure it gets spent in the right places.
But we don't want to rely on underspends, overspends, political persuasion, this and that. What we want is a cash sign increase in the prevention, I believe it's right, in that rather than hand-me-downs and hand-me-outs and pick me up and throw it to one side, but it doesn't. I want to see prevention, and it's my view, the committee, some of them, I mean, if not all of them, would echo this. We want to see you as a standalone. The grants coming in is a bonus, and always saying, when you go, we'll develop this into a recommendation, but we would rather see, no, let's not pound it anymore. We'd rather see this actually be solid. Councillor Marshall, let me bring you in.
Thanks very much, Chair. My question is about the youth worker side of things there, and about the Eston inspection that happened in 2024. On the report, it notes that the youth worker strategy remains at mapping stage. So it's just when can we be expected as a committee to know when it's likely to be completed on that side, but also just to understand, hopefully, a little bit of forward planning, but the aspiration of the next youth level award, because I believe, are we on silver or have we got to gold? Just clarity of where we are and what's needed to that point there. Thank you.
No problem. Thank you, Councillor Marshall. So the mapping of services is absolutely well underway, because part of that recommendation was we need to understand what the youth provision in the Craffu report, not just what we're providing. We've got an awful lot of that information. What's happened now is the Welsh Government have announced that we need to produce a 5-year youth service strategy, and part of that strategy is an enhanced bit of more mapping that we need to do. So I think we're well on the way to mapping as part of the Eston recommendations. I would even go so far to say I think we've more or less completed that. But because of this announcement now with the new work strategy, it kind of muddied the water. I have gone back to the team and said we need to keep those two things separate. If we've got recommendations against Eston report, we report to them in its entirety and keep the youth work strategy separate. So that will be clearer in the reporting going forward. But just to reassure you, that is well underway. I've got no concerns about that. In terms of the service, they're currently on silver. They are working towards gold, absolutely. There's been an awful lot of, I think the introduction of this youth work strategy is creating additional work for the team to be really thinking about and prioritising. There was also, I'm not sure if you're aware, there was an announcement around youth hubs being set up in every local authority. So that again has pulled in that service to be part of that initiative as well. So all of these additional programmes are welcome and, you know, are great for the young people of Newport. They do put additional strain on the resources that we have to be able to pursue other bits of work, and driving the goal remains a priority. I'm confident we will get there, and it's on our agenda.
That's great, Karen. Thank you. And with that, I hope with members understanding youth work, maybe to have like an information piece or like a kind of open for the committee to visit maybe the youth hubs, etc., and have that discussion to understand youth work and how it's different from obviously the formal education side and what it does. From understanding and being dealing with youth work, it makes such a change to people's lives. So it's great to see that positive moving forward in relation to that. And the team I know worked, you know, and give their all towards that as well. And it's just a side note, if Chair would allow me to note, another information session. Could we have an information session with all councillors about Flying Start? Because it's one that's coming up quite a lot. It's just about the information, about the changes and updates, so we're aware what to advise residents as and when, obviously, of the new changes, just so we're not giving outdated information there. Thank you.
We can put that into our recommendations at the end of the meeting. Thank you. And we've got the cabinet member education here who's all ears, and well, not really all ears, but we'll take that on board, I'm sure.
Absolutely.
Thank you. Any other questions on the report, Councillor Watkins?
Well, first of all, Chair,
thank you.
I've got to make a declaration of interest because I work closely with the cabinet member, Jason Hughes, and my two fellow councillors about the Nova Ymddiheuriadau project.
Yes, yes.
So I'm very involved with that, but I look forward to that coming to conclusion at the end of the 12 months.
No problem, thank you. Are there any other, I don't see anybody indicating. Thank you very much indeed for the report. And thank you to the cabinet member for
your processes.
for contributing to the meeting as well. Always welcome. So that's that part of the meeting done. We're going to hold a second and let these good people go.
Yeah. Thank you, Chair.
Thank you.
Yes.
Thank you.
What's it, 29?
28.
Yeah.
Thank you. Chair, can I see you next? You can't wait, can you, Councillor Rabbit?
Always a pleasure, never a chore. Take care.
Chair, I'll just really quickly whiz through what I've got noted, and obviously you can add anything or amend anything as we go. For the adult services report, it was only that request for further information on direct payments. And aside from that, I haven't got anything specifically noted, so just the committee can content with the report. Is there anything to be added to the adults outcomes, or are we happy there?
I don't think there is there? No, I think I'm happy, I'm content with that. Unless I missed something, but...
Brilliant. If we're happy, I'll move on to prevention.
Yeah.
I've got the request for updates on funding for water speed that came out of Councillor Reynolds' question.
Yeah.
I've got the request for information about Blwyddyn start, so the councillors are able to advise residents.
Yes.
The recommendation of rolling out the programme for the young carers champions within
Yes.
schools. Recommendation for providing training for governors on identifying young carers and signposting what support is available. And the recommendation about increasing the core budget for the service area when possible.
Yes.
Have I missed anything?
I don't believe so. There's a hand gone up.
Councillor Marshall?
Yeah, thanks very much. I suppose it's just an addition to the young carer side of things and updates, just generally where they have the meetings. If we can have updates as a committee about where there is, just so we're aware of what's happening with the Covenant, especially to keep an eye on things, as said, the education, that leads on to things like the chair said about governors and things like that already. Thank you.
Is there a question about Flying Start?
Yes, I've got that down.
Yes, I got the request for information about Blwyddyn start.
Yeah. Areas.
It was, wasn't it?
What we really want to know is how do they actually contact
Yes, so information you can share with your residents essentially, so point them in the right direction. I'll make sure they're no problem. That's everything I've got, Chair, for our recommendations.
Okay. Would updates?
Happy for me to go straight in?
Yeah.
So we've got a lovely clear actions table. There's the one, the smart number is ongoing, but I would suggest committee, if you're content, that we do move it to complete. And I know that the St Andrews School project has been completed. Yes. And I know that Millbrook is reported to the service area plans. Yeah. So you do get updates on those anyway. I'll mark it as complete and we'll have a nice clear table then. Forward work programme hasn't changed between our last meeting and now. Next meeting is the 28th of July, and that is the second round of end of year reports for children's services and education services. And that's all from me, Chair.
Thank you. There is no more any of the business. I haven't been indicated with any. So thank you for your attendance this morning. And enjoy the rest of your day. And I'll see you shortly. Take care. Bye-bye.
Thank you, Chair. Thank you, Chair. Bye-bye, everyone.
Thank you, Chair. Bye.